Hello, my name is Dr. Oliver Kunga, and today I'll be taking you through one of the commonest types of endocrine cancer, and that is the cancer of the thyroid gland. The thyroid gland is a butterfly-shaped organ found at the base of the neck, and it's actually one of the most active endocrine organs that is involved in many bodily functions, including mentation, including metabolism, among others. As the name suggests, when you have cancer of the thyroid gland, it is basically the thyroid cells that have multiplied in an abnormal way, giving you what we refer to as cancer. How is the presentation, or how do you know that you have thyroid cancer? As we've said, it's an organ that is found around your neck, and when you have the cancer, you will discover that perhaps there's an enlargement around the area of your neck. It could be in the whole organ or just a small portion of it, something we refer to as thyroid nodules. When we talk about the thyroid nodules, it can be in two forms. You can have the benign thyroid nodules, which basically means it's not cancerous. It's something, maybe it's overproducing hormones or it's causing your thyroid organ to be less active, and most of the time, benign thyroid problems don't lead to cancer. That said, sometimes in rare cases, you can have transformation into malignancies, giving you the cancer. Then the second type, of course, the malignancies, where you have the nodule or the whole organ involved, and that is what we refer to as thyroid cancer. So what are the risk factors? How do you know how to prevent it? Because once you know the risk factors, then you're able to either be on high alert or do certain things that can enable you to sort of predict that you're at risk and be able to see your healthcare provider to see how best to curtail that. The risk factors that have been widely documented are: one, genetic mutations, and that refers to certain familial conditions. Commonest, we have the multiple endocrine neoplasias, or what we refer to as MEN syndromes, and specifically the subtypes that have been associated with thyroid cancers, and specifically the medullary thyroid cancer, the MTC type, that is commonly found in the MEN2A and MEN2B group. So when you hear of the MEN syndromes or the multiple endocrine neoplasia syndromes, the 2A and 2B subtypes can be associated with certain forms of thyroid cancer. The other thing is radiation exposure. For the population who stay in places where there is erratic radiation emission, or you've been exposed to some form of radiation therapy, probably in childhood or at some point in your life to treat another condition, that can also be a risk factor for developing thyroid cancer. In the current era of autoimmune illness, severe viral infections, those have been documented in a few areas as certain things or certain risk factors that could also predispose patients to getting thyroid cancer. When we talk about the thyroid cancers, how are you able to tell that you or your loved one could be having thyroid cancer? So there are certain symptoms that may occur that may make you suspect that this might be a problem with my thyroid and I need to go in and get checked. By all means, we do not expect you to diagnose this by yourself at home. It's just the recognition of some of these symptoms that then encourage you or implore you to get into a hospital with the right healthcare provider for further assessment. So if you experience a lump in your neck, remember we said the organ is located round about the base of your neck. So if you experience some sudden swelling around that area, some changes in your voice, some irritation or pain around the area of your throat, then you need to suspect that something could be going on and you go in for a physical assessment. When it comes to diagnosis of thyroid cancer, there are various things that will need to be done when you get to the hospital. One is a physical exam, which basically includes assessment of your neck, and in addition to that, various organs, because remember, the thyroid gland is responsible for multiple functions within the body, and whenever it's affected, particularly with the cancer, other organs will need to be checked as well. So the physical assessment will be done by the doctor, followed by certain specific diagnostic tests, which will include laboratory tests, meaning that your blood will be drawn to check some of the tests that we refer to as thyroid function tests, And in addition to that, imaging may be done using various modalities. In our setting here in Kenya, ultrasound studies would be the most easily available. And in addition to that, other advanced imaging, for example, CT scans, MRIs, and even PET scans, which have now come in as an advanced modality to be able to tell us, is this cancer just around your thyroid gland or has it spread to other organs? So all those tests will be done and prioritized in terms of what you can access as a patient, as well as what the healthcare provider deems necessary as far as nailing the thyroid cancer diagnosis. In addition to that, a sample will be collected from your thyroid gland, and we refer to it as a fine needle aspiration cytology, where basically some cells are collected from the thyroid gland and assessed by a pathologist in the laboratory to be able to clearly ascertain that the cell types that are found there are malignant or of the cancerous type. Once that is found, a specific diagnosis, which we refer to as a histological diagnosis, will be given, basically meaning that we will label your cancer to be of a certain type, so that then the treatment approach is structured to the cancer that you have. The four commonest types of cancer are: 1, papillary thyroid cancer, which is the commonest, even here in Africa, accounting for up to 80% of the cases that we see. The other common types of thyroid cancer are medullary thyroid carcinoma, the follicular thyroid carcinoma, and anaplastic thyroid carcinoma. Those are basically the four commonest types, which are labeled based on the histological presentation or presentation based on tissue collected from the thyroid gland. Once we label your thyroid cancer as specific histological type, your healthcare provider will discuss with you the treatment options that are available. The basic treatment offered for thyroid cancer would usually be surgery, and surgery will involve either removal of a part of the thyroid gland, probably where the nodule or the cancerous part is sitting, or removal of the whole thyroid gland, which we call a total thyroidectomy. The other treatment modalities that could be offered involve chemotherapy, radioactive iodine therapy, particularly in the context of post-operation, where the radioactive iodine therapy will be very useful in eliminating any remnants of the cancer tissue. Radiation therapy, certain targeted therapies for cancers may also be used, but all this is based on what is available in your setting, what is accessible as far as costs, and also the expertise. So as much as possible, we encourage that if you or your loved one has thyroid cancer, kindly involve the services of an endocrinologist who will partner with an oncologist, among other specialized professionals, to be able to offer you the best care possible. The good news is that thyroid cancers, by and large, particularly when diagnosed early, are actually very treatable with a very decent survival rate of up to 85%. So we continue to encourage members of the public to seek care as urgently as they can, particularly when some of those symptoms that we've talked about are observed either in you or a family member or someone known to you, so that we can have early diagnosis, early treatment, and a fair chance at long survival. I hope you've learned something or two about thyroid cancers, and that you will be able to share this video, share this information with your loved ones, so that together we can all improve the outcomes of our patients, particularly in the context of endocrine cancers, and the one we've discussed today, specifically being thyroid cancer. Thank you, and see you next time.